Hello to you all on this sunshiny Sunday. I hope you're getting out there and enjoying the good weather in Calgary and walking the parks and the trails, obviously with safe distancing. I wanted to pop on just for 2 minutes to chat to all of you about what we're doing in the clinic right now for our patients with chronic illness, and especially those who are susceptible for COVID-19, how we are maintaining their immune systems during COVID-19. We're very comfortable with the inflammatory cascade because what we do in the clinic is mostly chronic inflammatory response syndrome. Our patients have chronic Lyme or chronic bioinfections from Lyme, associated with Lyme, chronic viral like Epstein-Barr virus or herpes virus or echovirus, and obviously a lot of biotoxin mold illness patients in Calgary. And so for that reason, we are very aware of how to check the immune system and see whether it's immunocompromised, upregulated, or healthy and balanced. We in the main use markers like the T-cell CD3 count to assess the virus capacity in the immune system, and the NK57 natural killer cell count to assess how the immune system will respond to bacteria. We also make use of immunoglobulins like IgG and the subclass deficiencies and manage those. So when it comes to knowing where your immune system is at with respect to our patient population, we really usually know where they're at and what we need to do. And when we look at that, what we've been doing for the last 33 years, it's easy to pivot and use some of those protocols and methodologies in our patients who are at risk for COVID-19. So in summary, the take-home message is that there are more or less 5 to 7 supplements that are very cheap, very safe, and quite effective at supporting and maintaining a healthy immune system. So right off the bat, we humans have a natural cellular defense system, and when a pathogen is found by the immune system, interleukin-6 pushes the panic button and says, guys, we've got to get on our motorbikes and start dealing with this. And that sets off a very known inflammatory cascade that is step by step until the pathogen is annihilated. Sometimes the body can't annihilate the pathogen, and that's when we get a chronic inflammatory response syndrome, a SIRS. And this can be problematic and very draining for the human on a number of levels. So in order to modulate the biggest and baddest boy in that inflammatory cytokine storm, we use a lot of N-acetylcysteine, NAC, alpha-lipoic acid, ALA, and glutathione to modulate NF-kappa B. He is the ultimate biker, if you like, who's going to go on a tear and inflame you chronically and long. So N-acetylcysteine, alpha-lipoic acid, and glutathione are our top 3 ways of modulating NF-kappa B in somebody who is markedly inflamed. Now, Dr. Richard Horowitz is an amazing physician. He's committed his entire career to chronic illness, especially chronic Lyme and chronic Lyme co-infections. And he publishes frequently about his patients with Lyme and Lyme co-infections. And in April, I read his article in the Journal of Respiratory Medicine, case studies. You can Google that. It's, I think, April 2020. And just Google Horowitz, Richard, glutathione, COVID, and it'll pop up. So when we use these 3 supplements in the clinic, we have very few side effects. So these are safe. We start with N-acetylcysteine, which traditionally is used to support liver function. It's one of the amino acids that makes glutathione, which is our top dog in the world of antioxidants. So we use a dosage of N-acetylcysteine, NAC, 600 milligrams, 2 or 3 times a day. 3 times a day, a dose of 1,800 milligrams would be perfect. The second supplement that we often use together with NAC is ALA, or alpha-lipoic acid. And alpha-lipoic acid also modulates NF-kappa B. And then finally, we use glutathione for a host of different things, but it's very useful in patients with ARDS, ARDS, acute respiratory distress syndrome, which is what we're commonly seeing in the lungs of patients with COVID-19 and COVID pneumonia. It is an amazing adjuvant in the treatment of COVID pneumonia and in the prevention of COVID-19 to support the immune system. And what dose of glutathione do we use? If you're a healthy, normal individual, 250 milligrams twice a day of liposomal glutathione would be wonderful. If you're over 55, like myself, I use a higher dose. I use 1 gram a day, 500 milligrams twice a day. And if you're worried that you might have COVID or have a chronic infection and you are highly susceptible to COVID-19, we could even go as high as 2 grams a day of liposomal glutathione. Obviously, the other 2 supplements that we use a lot of are vitamin C and also zinc. We use zinc 40 to 50 milligrams a day in almost all of our patients, and vitamin C we use anywhere from 2 to 3 grams a day. You don't need to start that high, and you need to watch out for diarrhea. It can increase transit time. So if you're new to vitamin C, I would start probably at 250 milligrams twice a day and work up to 1 gram a day, and then work up to 1 gram 3 times a day, and then go from there. We can't, as humans, make vitamin C, so we have to eat it or supplement with it. And it's a profoundly important antioxidant when dealing with oxidative stress. The secret, of course, with COVID-19 is that the virus can really only cause havoc if there is oxidative stress in the cell. So if you can lower oxidative stress, you're far less vulnerable to having any ill effects when COVID-19 comes around to visit. So things like glutathione and vitamin C are top dog antioxidants. I would say that almost every single one of my patients that I'm seeing in clinic is on those 2 supplements, glutathione and vitamin C, and probably also zinc. For a whole host of other reasons, but for immune system stabilization as well. I also wanted to talk a bit about testing. Unfortunately, we don't have widespread, easy testing yet, but this is afoot. We know that at the moment, most of us are using PCR, nasal and nasopharyngeal tests here in Calgary. And the tests are not as accurate as we'd like them to be. But when we look at the serum IgA, IgM, and IgG tests, those too aren't as perfect as we'd like them to be. I think that we're going to be moving maybe more toward antigen testing to see if there's active virus present in the now. But that's probably a little ways away for most of us. The FDA just approved, I think a week ago, an IgA test from, I think it was Rutgers University in the States. So it's coming. And in that sense, it's a lot like Lyme, where the tests there too are inaccurate and not perfect. And we do the best that we can with what we have. So in summary then, I would say that if you're out there and you have any concern at all about your immune system, an easy and very simple thing to do is to get moving. Moderate exercise, incredibly beneficial for your immune system. Getting enough sleep is the second most important lifestyle thing that you can do. And thirdly, eating an anti-inflammatory diet, eating real food. After that, if you want to get into supplements, my top 5 that we're currently using in clinic right now, myself and all of my other clinicians, are number 1, liposomal glutathione, number 2, vitamin C, number 3, N-acetylcysteine, number 4, alpha-lipoic acid, and number 5, zinc. Not necessarily in that specific order. So yeah, that's really what we're doing. Okay, so I'll sign off now and wish you a happy rest of day and a good week ahead. Take care.